Some of medicine's greatest breakthroughs began with noticing a small, quiet symptom, what Hippocrates called the body's whispers. As we age, these subtle signals become even more important. Listening isn't about anxiety, it's about empowerment and catching problems early before they become crises. In this video, we'll tune in to 7 silent symptoms you should never ignore after 50. We'll explore what they mean, why they matter, and how modern medicine can help. This is about knowledge, not fear, giving you the tools to navigate your health with confidence. Let's begin. Let's begin by talking about profound, unexplained fatigue, a deep, overwhelming exhaustion that lingers no matter how much you rest or sleep. This isn't the kind of tiredness you feel after a long day or a restless night. It's a persistent, draining fatigue that can make even simple daily tasks feel impossible. You might find yourself struggling to get out of bed, losing interest in activities you once enjoyed, or feeling like you just can't keep up with life. This isn't just ordinary tiredness. It's your body's way of waving a red flag, signaling that something deeper may be wrong. When fatigue is unexplained and ongoing, it's important to pay attention. Your body is trying to tell you that it needs help. One of the most common causes of this kind of fatigue is anemia, especially in women after menopause. Anemia means your blood doesn't carry enough oxygen, leaving your muscles and organs starved for the energy they need. This can make you feel weak, dizzy, and short of breath, even after minimal activity. Another frequent culprit is an underactive thyroid, or hypothyroidism. When your thyroid gland isn't producing enough hormones, your metabolism slows down. This can lead to weight gain, sensitivity to cold, and most noticeably, a constant sense of fatigue that just won't go away. Diabetes is another condition that can sap your energy. When your blood sugar is out of balance, your cells can't get the fuel they need, leaving you feeling tired and sluggish. Sometimes fatigue is one of the very first signs that your blood sugar levels are not where they should be. Most critically, persistent fatigue can be a warning sign of heart disease. In fact, for many women, overwhelming tiredness is sometimes the only symptom before a heart attack. If you notice that you're unusually exhausted after mild activity, or if you feel tired even when you're at rest, it's time to take it seriously. Ignoring this symptom means missing a crucial opportunity to catch treatable conditions early. Fatigue is not something to brush off or attribute to simply getting older. It's a message from your body that deserves your attention. If you're experiencing new, persistent fatigue that doesn't improve with rest, don't ignore it or hope it will go away on its own. Reach out to your doctor and share your concerns. Remember, this is your body's way of asking for help. It's a gentle but urgent whisper that something needs to be checked. Getting a simple blood test or a checkup can often reveal the underlying cause of your fatigue. Many of these conditions are treatable, and the sooner you know, the sooner you can start feeling better. Early action can truly change everything. Listen to that whisper. Your health and your future may depend on it. Shortness of breath with even mild activity is a vital warning sign that should never be ignored. If you find yourself needing to stop and catch your breath after climbing just a few stairs, walking across a room, or doing simple household chores, your body is trying to tell you something important. This isn't just a normal part of aging or being out of shape. It's a signal that something deeper may be going on. When you feel breathless, it's not just about your lungs. Your heart, your blood, and your entire circulatory system are all involved in delivering oxygen to your body. If any part of this system isn't working properly, you may notice it first as shortness of breath. The heart and lungs work together as a team, and when one struggles, the other feels the impact. For many older adults, especially those with a history of smoking, conditions like COPD, chronic obstructive pulmonary disease, and late-onset asthma are common culprits. These lung conditions can make it harder for your body to get the oxygen it needs, leaving you feeling winded even after light activity. Persistent coughing, wheezing, or needing to use an inhaler more often are all signs that your lungs may be struggling. But it's not just your lungs. Anemia, a condition where your blood doesn't carry enough oxygen, can also leave you feeling breathless and fatigued. If you notice you're unusually pale weak, or tired, anemia could be the reason your body is struggling for air. Most importantly, heart problems are a major cause of unexplained breathlessness. Conditions like heart failure or blocked arteries often show up as breathlessness, not chest pain. Your heart may not be pumping blood as efficiently as it should, making it harder for oxygen to reach your muscles and organs. For many people, especially women, shortness of breath is the main sign of a heart attack. Unlike the classic chest pain, women are more likely to experience subtle symptoms like fatigue, nausea, or breathlessness. This makes it even more important to pay attention to these warning signs. Don't dismiss breathlessness as just being out of shape or getting older. It's easy to brush it off, but ignoring it can be dangerous. Your body is giving you an early alert. Don't wait until things get worse. If you notice new or worsening breathlessness, especially if it comes on suddenly or is accompanied by other symptoms like chest discomfort, dizziness, or swelling in your legs, seek medical advice right away. Early diagnosis can make a huge difference in your treatment and recovery. Remember, shortness of breath can be caused by problems with your lungs, your blood, or your heart. Each of these requires a different approach, and only a healthcare professional can help you find the right solution. All of these causes are serious and deserve your attention. Don't try to adapt or push through. Take action. Getting help early can prevent complications and improve your quality of life. Your body is sending you a message. Listen to it, respect it, and don't hesitate to reach out for help. Taking your symptoms seriously could save your life. Memory changes can be frightening, especially as we age, and it's natural to worry when you or a loved one starts forgetting things. But it's important to remember that not all memory lapses are simply senior moments. Sometimes these changes can signal something more significant happening in the brain. Occasional forgetfulness, like misplacing your keys or forgetting a name, is common. However, when forgetfulness becomes persistent, worsens over time, or starts interfering with daily life, such as missing appointments, repeating questions, or getting lost in familiar places, it's a red flag that shouldn't be ignored. One often overlooked but treatable cause of memory problems is a deficiency in vitamin B12. This vitamin is essential for healthy nerve function, and older adults are especially at risk for low levels. Fortunately, with proper diagnosis and supplementation, memory can sometimes improve dramatically. Vascular issues, such as high blood pressure, diabetes, or high cholesterol, can damage the tiny blood vessels that supply the brain. Over time, this can lead to gradual memory loss and cognitive decline, making it crucial to manage these conditions proactively. Sometimes, people experience silent strokes, tiny, unnoticed interruptions in blood flow to the brain. These silent strokes can slowly chip away at thinking skills and memory, often without any obvious symptoms, until significant damage has occurred. Alzheimer's disease is the most common cause of dementia, affecting millions worldwide. While there is currently no cure, early diagnosis and intervention can help slow its progression, allowing individuals and families to plan, seek support, and maintain quality of life for as long as possible. It's also important to recognize that memory can be affected by factors beyond physical brain changes. Stress, depression, anxiety, poor sleep, and thyroid problems can all impact memory and thinking. Addressing these issues with your healthcare provider can sometimes lead to significant improvement. If you notice memory changes that go beyond the occasional lapse, don't brush them off or hope they'll go away. Early evaluation by a healthcare professional can help determine the cause, whether it's something reversible or the first sign of a more serious condition. Remember, your mind is your blueprint for life. Protect it by seeking help early, staying informed, and supporting loved ones through changes. Your memories are precious, and taking action now can make all the difference for your future well-being. Losing weight without trying may seem positive, but it's a major warning sign. Unintentional weight loss, over 5% in 6 to 12 months, signals a problem. Causes include overactive thyroid, undiagnosed diabetes, digestive disorders like celiac or Crohn's, and even cancer. Cancer cells consume energy rapidly, often causing early weight loss. Don't ignore shrinking numbers on the scale if you haven't changed your habits. The reason matters more than the result. Early investigation can reveal treatable conditions. Listen to your body's message. Get checked. Persistent digestive changes, heartburn, constipation, diarrhea, bloating, or blood in stool are not minor annoyances. They're signals from your gut that something's wrong. Peptic ulcers, IBD, like Crohn's or ulcerative colitis, and IBS can all cause lasting symptoms. Most critically, subtle changes can be early signs of colorectal cancer, one of the most treatable cancers if caught early. Screening is important, but new symptoms mean you shouldn't wait. Don't just manage with over-the-counter remedies. If digestive changes persist, see your doctor. Your gut is telling you something. Early action saves lives. Trust your instincts. Numbness or tingling in your hands, feet, arms, or legs is a warning from your nervous system. It could signal a mini-stroke, TIA, which often precedes a major stroke. Peripheral neuropathy, common in diabetes, can cause these symptoms and lead to unnoticed injuries. Pressure on nerves from herniated discs or carpal tunnel can also cause tingling. Vitamin B12 deficiency can damage nerves too. Don't ignore these sensations or try to shake them out. They're signs of nerve trouble, blood flow issues, or more. Each cause needs a different response. Get evaluated quickly. Protect your mobility and safety. Chest pain isn't always dramatic. It's often subtle, especially in people over 50 and in women. Heart attacks can start with pressure, squeezing, fullness, or even severe indigestion. Discomfort may radiate to the arms, jaw, neck, or back. For women, symptoms like fatigue, breathlessness, nausea, or sweating may be the main warning. If you notice new, persistent, or severe symptoms, especially with exertion, think heart first. Don't wait for classic pain. Time is muscle. Every minute matters. Go to the ER if you're unsure. It's better to be safe than sorry. Learn your heart's subtle language. It could save your life. We've explored 7 crucial whispers: fatigue, breathlessness, memory loss, weight loss, digestive changes, numbness, and chest discomfort. Each is a clue. Don't ignore them. You are your own best health advocate. Observe new symptoms, note details, and seek help early. Proactive action is wisdom, not worry. Share your experiences in the comments. Your story could help someone else. Like, share, and subscribe for more health wisdom. Thank you for watching.